Good morning, everyone, members of the media. Do not have a prepared statement this morning, but I'm happy to take your questions.
Okay. So there has been a significant drop in numbers recently. So can you provide an explanation for that?
Well, Elizabeth, if you look at the days that we have been testing, on the days that we've been testing right now, which is active case finding, we have found between 50 and 60 cases every day. When we shut down our operations on Friday last week, with the storm impending on us, we have not done mass testing since Friday. So no mass testing on Saturday, Sunday, Monday, Tuesday, and today. Everybody needed a day to reset. We're going to resume our testing tomorrow. So I suspect that our numbers will go back up tomorrow when we resume our testing program. But remember, that is active case finding. I mean, we're out looking for cases. So.
And so that basically answered like most of my questions. So you expect to see an increase when you resume testing. Are you going to add days to the testing period?
We right now, most of our testing sites are at the schools. And when the schools reopen, we will lose those sites. So we are working on phase 2 or version 2 of our testing. That will involve standing up a test site at the health department that'll be open 4 days a week. And then we will probably do some pop-up testing. We're still working on that at this point. We anticipate being out and doing some school immunizations in the community, and we'll likely combine some of our testing activity with that. Of course, that would all require consent. We can't vaccinate any child or test any child without parent or guardian consent, but we will likely stand that up as we get into our vaccination season, which is coming. So we are in the process of planning for that operation.
And just to clarify, the numbers haven't been lower than and that was due to just the testing every single day.
Yeah, we're not the only testing operation in the county. Many medical practices in the county are offering testing. The hospital is doing testing through the emergency department. The hospital is also doing testing for people coming in to have non-emergent procedures and then prior to emergent procedures. There's also the state program, the CHAMPS program, which Vidant Health is part of, and they've been doing some testing through that. They'll have a site up at Belvoir Elementary. I think that opens today, actually. And they'll be testing folks in that community up there through that CHAMPS grant from the state health department. Yeah, you can't really run the testing site and have the school open for business. So when the schools reopen, we'll lose those testing sites, and that's part of the reason to retool our testing campaign.
And so far, can you present an overview of what trends you've seen?
Even though our total cases, questions about trends in our data. So even though the total case count is up, so yesterday I did a quick review of cases. We had 1,795 total cases as of yesterday. We estimated that 1,245 were recovered, which left us with 550 active cases, or cases that are less than 15 days old. And if you divide that by the county population, that gives us a rate of about 3 per thousand. When I look at this morning's number, we haven't done our recovered number yet this morning, but we stood at 1,802 for total cases, 1,802 cases, with 1,245 recovered as of yesterday. It left us 557 active cases, so still calculates out to be 3 per thousand in that analysis. So our overall rate per population seems to be steady in spite of increased testing. So I do think that's a good thing. It doesn't mean that the problem has gone away, but it means that the burden of disease is stable. When I look at the state website for our percentage of positivity, we are still at 7% positive in our across the testing program, and that is level. The Vidant Health data, they test across their 29 county footprint. And in their testing data, they're running 7.1% positive. So that seems to be consistent with the region and match well with the Vidant testing data.
So what does this mean for the county? Does it look like they're coming anywhere near to an end? Does it look like there's less disease in the county? Or just 37%?
Yeah, I think unfortunately the burden of disease is about the same, and that COVID-19 is going to be part of the what we call the microbiome, the collection of microorganisms that share the environment with us for a long time to come.
And I know in the past you said that like the largest group of people with COVID-19 in the county is 25 to 49.
Mhm.
So as ECU starts back next week, do you expect to see this demographics change?
That may shift a little bit down. If you think of the typical college age student is say 18 to 22 or maybe 18 to 23. Most of the 20,000 plus students are undergraduates coming back, and they would fall into that age group. The graduate students are more diverse in their age range. Some of them are right out of college going into their graduate studies program. Some of them are slightly older adults or even older adults who have gone back to get an advanced degree. So we may see some there. I certainly expect that there will be some clusters and some cases among the ECU students. One of the things that we really don't know is how many of these students who are returning have already had the infection. So we've talked about that with ECU and maybe offering some antibody testing on campus through their student health service. And that's something that they were considering and trying to look at what percentage of the student body really has had it already.
And if you can get coronavirus more than once, so is the university kind of concerned about that? Like what
Mhm.
does it mean to the university when we know that some of their students have already had coronavirus?
So the question's about whether you can get coronavirus more than once and what does that mean? And the jury is still somewhat out on that. We know from looking at SARS and MERS that people did form protective antibodies that lasted probably for at least 6 months in those cases. SARS and MERS both kind of burned themselves out very quickly, so we never really got to see how long those antibodies persisted and if they maintained protection. With COVID-19, we think that there are protective antibodies probably for at least 3 months. We know that people can shed inactive virus for up to 3 months. So it's still not clear whether you can get it a second time or not. There's probably a small percentage of the population that can, but in most cases, when you get a virus for a second time, the disease is much milder and much shorter in that second case.
And across the country, like when schools are reopening, we get like the first week, they're already having to quarantine schools. So
Mhm.
what do you think this means for Pitt County as first week of the reopening as we see starts next week?
Mhm. Well, first of all, let me say I support Dr. Lanker and the Board of Education in the decision that they made and have been working closely with them on the reopening of schools. As I said to the Board of Education, I don't think it's a question of if you're going to have a cluster in one of the schools. It's a question of when. On any given day, across the division is broad. About 60% of students chose in-person learning, or families chose in-person learning. 40% of families chose complete distance learning. So on any given day across Pitt County School, there's going to be about 30% of their normal student body present. So that decreases risk in and of itself. If they're able to maintain their masking and hygiene and distancing, social distancing, the risk is very low. The risk in most students, if they were unlucky enough to acquire the infection, is also very low. So that's a good thing. For some of the faculty and staff, that can be a higher risk. And we did talk about making individual allowances for faculty and staff that were at higher risks from the infection. But I support it. I do expect that we will see some clusters in schools. Whether or not we'll have to close them down depends on the particulars of that situation. And myself or my staff will work closely with the school district when a case is identified to make those decisions. Okay.
So, did we talk about the testing opening back up tomorrow?
I did not, but I'm happy to comment on that, Mike. As we put out in our written press release, our COVID-19 testing program was suspended Monday, Tuesday, and Wednesday of this week in relation to the storm, and just trying to give everybody the forecast was in flux, and we had to make a decision Friday afternoon as to whether or not we were going to test on Monday. We chose not to. Of course, the storm didn't get here till Monday night. And then yesterday was kind of with the storm coming through in the middle of the night. Many of our staff, emergency management staff, were up through the night of the storm. We felt like everybody just needed a day to sort of rest and reset before we put our assets back out in the field to conduct testing. So in the interest of staff safety and the public's safety, we decided to postpone the opening until tomorrow. But we will be back on our normal schedule tomorrow with the J.H. Rose site open from 8:30 to 12:30, the Moywood site open from 10 to 2, and on Thursdays we are at Aiden Middle School in the rotating site, so that'll be open from 8:30 to 12:30 as well, and those things are on our Pitt County website.
And that's just this week, right?
Um, School's open on the 17th, so next week we will test on normal schedule, barring any kind of weather or other emergency. From Monday through Friday, we'll be on our normal testing schedule next week, and then after Friday, we will be retooling that schedule.
And that will be announced on Friday.
Yeah, probably. Okay, we will get that together and get it out to y'all. All right. Any other